Hi, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about why estrogen can contribute to hypothyroidism. And I see this clinically a fair amount. And what happens is people get on too high of a dose of estradiol, whether it's in a cream or in a patch, and their estrogen levels rise, and then they start to have hypothyroid symptoms, one of which is an elevated TSH, thyroid stimulating hormone. And the reason is that estrogen is very much involved in the regulation of thyroid hormone. And the way that this gets played out is that high estrogen can cause hypothyroidism because high estrogen signals to the liver to produce thyroid globulin, thyroid globulin hormone, which then binds the thyroid hormone, right? So it's taking the thyroid hormone out of the blood, binding it, and then there's less thyroid hormone available for binding to the receptors on various organs. So that's one problem. Estrogen regulates the protein that binds the thyroid hormone in the bloodstream. So that's another problem. Also, too much thyroid can block the uptake of thyroid hormone, in particular T3. So liothyronine can be blocked. The uptake of it can be blocked when you have too much estrogen. When you block T3, it is not good, especially in tick-borne illness patients. In my practice, which now is 26 years, the biggest problem is, I would say, is the regulation of T3 hormone. It's a huge problem. And T3 is so important for metabolism, for, well-being, for sleep, for everything, really. So that's also a really big problem. So estrogen, it's said that estrogen has an indirect effect on thyroid. I don't think so. I think it's a direct effect. I just think we're not able to measure it. Not in a clinical setting. You'd have to do these assays like they do in research, and we just don't have that option in clinical medicine. So what I tell patients, this just happened with a patient, and so what you need to do in order to rectify this situation is cut the estradiol dose in half. So if you give 0.2 mils, give 0.1 mil. And before you start regulating thyroid, okay? Because by adjusting the estrogen, your thyroid hormone is more likely to come into balance. You need to wait, 90 to 120 days because that's how long it takes for hormones to balance out. And I know that's a pain in the neck, and I'm sorry, but that's just how it is. So definitely elevated estrogen can look like, can cause low thyroid function and high TSH. So before you start altering the TSH, alter the estrogen, get that down to half the amount, and then obviously watch the thyroid hormones, but more often than not, they will come into balance, and you may need to add a little bit of T3 or T4, but it's not going to be a major ordeal like, if your TSH is 8.0, it's not going to be like that, because when you alter when you lower the estrogen, it'll help rebalance the thyroid. So, all these hormones, they're like a symphony, and they work together, and they're amazing. They really are. They're really amazing. But you got to get it right, especially in postmenopausal women, or you're going to have panic attacks, fatigue, weight gain, insomnia, and you've already got enough issues when you're in menopause with hot flashes and all these other things. So, um, anyways, that's my pearl for today. I hope you have a great day and a wonderful weekend. Take care.